The Arnau de Vilanova hospital is a reference hospital for the whole of our territory. 400,000 people have us as a reference for their emergencies. We see an average of 250 to 300 people every day with different degrees of complexity.
In winter, we have a really hard time because we triple or quadruple the real capacity we have in the emergency department.
What we were looking for by adding artificial intelligence with Mediktor was to give an extra point of quality to the reverse referral process. We wanted to have a tool that would help us in that process of saying you should stay or you should go, and also to help the patient reflect on why they had come to the hospital. Reverse referral is what we call when we refer a patient out of hospital. It consists of someone who has come to the hospital after an initial assessment being referred to another center where they can be treated with the same quality as we do and even faster. And in this case, we are referring them from the hospital to the HUAV in Lleida.
When the patient arrives at the emergency department, the triage level is decided, a level of severity that is assigned to the patient. Then, low complexity patients with a level 4 to 5 are the ones we offer to use Mediktor.
And they are given a tablet on which the patient answers the questions that Mediktor tells them. At the end, the application makes a recommendation. Based on what you've told me, it would be better to stay in the hospital, or based on what you've told me, you could go to the HUAV.
If they agree, we explain to them that they will have to wait many hours here. That with this option we can refer them to another center where they will be able to be visited much faster. And most of them accept and leave.
The vast majority of people accept the recommendation when Mediktor tells them to go to the HUAV, I think in about 95% of the cases. A curious thing is that about 30% of the patients that we have recommended to go to the HUAV have not even gone to the HUAV in the end. They just returned home.
A HUAV is a primary care emergency center that attends low and medium complexity emergencies. Being seen in a HUAV normally guarantees that you will be attended faster. The aim is that services can be optimized and used in a correct way and at the same time provide health education.
I believe that the implementation of artificial intelligence in the system is not a future challenge but one of the present. And I believe that there will be more and more tools like this that will help us to make better use of resources, to distribute teams, and to predict what type of pathology we can treat based on previous records.
I think this is very empowering for nurses. And, well, I felt proud to be able to do something as a nurse that is usually outside of what we usually do.